Microperforate hymen is a type of hymen that looks like a thin, delicate membrane with many very small holes, like a tiny sieve. It usually does not block the vaginal opening, so most people can urinate and have menstrual flow without trouble. However, the small openings can make it harder to notice during a routine physical exam. The condition is mostly a natural variation that a baby is born with. It is not caused by infection, injury, or a disease. Genetics may play a small role, meaning the way the hymen forms in the womb can differ from one person to another, resulting a microperforate pattern. Because the opening is still present, many people do not feel any pain or problems. Some may notice a thin, almost invisible membrane when examined, slight difficulty inserting a tampon or a small medical speculum, occasionally a feeling of a tight or sticky area during sexual activity, but usually no pain. If the holes are very tiny, a tampon may not absorb fluid properly, which can be a practical sign. A health professional can see the microperforate hymen during a gentle visual exam with a speculum or a hand-held mirror. No special lab tests are needed. Treatment is usually not required unless the small holes cause functional problems. If a person has trouble using tampons, a doctor may suggest a soft lubricated applicator or a menstrual cup designed for narrow openings. In rare cases where the hymen causes pain or severe bleeding, a minor surgical procedure called hymenectomy can gently remove or reshape the tissue. Since the condition is a normal anatomical variant, there is no real way to prevent it. The best prevention is simply good education, teaching young people that a variety of hymen shapes exist and that none are a sign of health problems. This reduces anxiety and avoids unnecessary medical visits. Recent studies have looked at the range of normal hymen shapes using high-resolution ultrasound and 3D imaging. These tools help doctors differentiate a microperforate hymen from other conditions, like hymenal scarring or atrophic changes. Research also shows that using flexible low-pressure menstrual cups can be safer for people with very small perforations.